All right, today we're diving into a real medical mystery, a gut disease that might be secretly attacking the muscles throughout your entire body. And let me tell you, the final verdict? It's really not what you'd expect.
So you probably think of Crohn's disease as this big battle happening right in the gut, right? But what if that's not the whole story? What if the damage is spreading? That's the big question we're tackling today. Could the real, hidden front line of this disease actually be our muscles?
Okay, so to crack this case, first things first, we've got to get to know our main subject, Crohn's disease. And trust me, it's a whole lot more than just a bad stomachache.
So Crohn's is a type of IBD, inflammatory bowel disease, but its impact, man, it goes way beyond the gut. Think of it like this. The chronic inflammation it causes is like a saboteur attacking your body's entire supply chain. It messes with your appetite, it blocks your body from absorbing nutrients, and all of this puts patients at a super high risk for malnutrition.
So, think about it. If your body is being starved of the fuel it needs and it's constantly on fire with inflammation, what do you think happens to everything else? It leads us to this really critical question. What if that inflammation is literally stealing from one of our most vital tissues, our muscles?
And that right there brings us to our prime suspect, a condition called sarcopenia. Now, what is that? It's basically the loss of muscle mass and function. And you know what drives it? You guessed it, chronic inflammation and malnutrition. It's the perfect storm created by Crohn's disease. Sarcopenia is pretty much a direct result of the body being under constant attack.
Now, this isn't just some wild theory. The evidence in the medical literature is, well, it's staggering. It's estimated that something like half of all patients with Crohn's have this muscle-wasting condition, 50%. I mean, think about that. That sets a really clear expectation for what we should find, right?
Okay, so with that huge number in mind, a team of medical detectives, or, researchers, at the National Institutes of Health decided to investigate. And their study is exactly what we're digging into today. So let's ask, who were the subjects in this investigation?
All right, let's look at the evidence board. We start with 53 patients. On average, they're pretty young, just 38 years old. But here are the really crucial clues, so pay attention. A huge majority, 79%, were in clinical remission. That means their symptoms were basically under control. On top of that, every single one of them was on medication and was physically active. Keep those details in your back pocket because they're going to be super important later on.
So how do you even look for something like sarcopenia? Well, the researchers had a 4-part toolkit. First, they tested pure strength with a hand grip test. Then, for endurance, they used a 30-second chair stand test. For mobility, it was a simple walk test. And finally, to get a look at total muscle mass, they used something called bioelectrical impedance. It was basically a top-to-bottom checkup of their muscle health.
So the team gathered all their data, crunched the numbers, and got ready for the big reveal. And based on everything we knew, the outcome seemed like a total slam dunk, right? But what they found was a plot twist nobody saw coming.
Just to remind you, remember that stat? That up to half of Crohn's patients have sarcopenia? So the expectation, the baseline, was that they'd find it in, maybe 26 of these 53 people. That was the number to beat.
And the actual number of patients in this study who had sarcopenia was this: a big, fat 0.
You heard me. Not one out of 53 people. In a group where we expected to find it in half of them, they found 0 cases. This isn't just a surprising result. This completely flips the whole mystery on its head. What is going on?
So what happened here? Why was our prime suspect, sarcopenia, a complete no-show? To figure it out, the researchers had to do what any good detective does: go back to the evidence board.
And this really is the million-dollar question, isn't it? We know the link between Crohn's and muscle loss is strong. It's well documented. So what was so special about this group of 53 people? Well, the answer was hiding in plain sight, right back on that evidence board, in the patient profiles.
Okay, let's break down these clues. Clue number 1, disease status. Most of them were in remission, which means their inflammation levels were low. Clue number 2, effective treatment. Every single patient was on meds, and some of those anti-inflammatory drugs can actually help reverse muscle wasting. And clue number 3, age. The average patient was 38, so they weren't really dealing with age-related muscle loss yet.
So this gives us a fascinating expectation versus reality moment. The common expectation was Crohn's disease equals inevitable muscle loss. Simple as that. But the reality this study points to?
It's that if you effectively treat the inflammation, you might be able to protect the muscles and stop sarcopenia in its tracks. And that, right there, is why this is such a big deal. This is a really hopeful story. It suggests a huge shift in thinking. If you can get the core inflammation under control, you might not just be treating the gut, you might be protecting the entire body.